Hi everyone, Steph here. I'm a cosmetic nurse in Melbourne, Australia. If you're new to my channel, welcome. Today I wanted to talk a little bit about what you can expect during a consultation and things you can ask your cosmetic nurse. So cosmetic treatments are still medical procedures. They carry inherent risks and side effects. So you want to make sure that when you find a cosmetic nurse or doctor, it's important to make sure you feel comfortable with them, that they're able to answer any of your questions and have that support during that whole time that you get the treatment done. Finding a cosmetic practitioner that has the same aesthetic goals and values as you is very important. Now this can be difficult because in Australia we actually can't advertise our before and afters, but we can still give you some background information and show you our work in the private consultation. So recently the Therapeutic Goods Administration have released the refined guidelines on advertising cosmetic treatments. So this means that we can't show our before and after work online. We can't talk about the pricing for any of the treatments we offer. This can be quite difficult for a new patient wanting some treatments done because we don't know what that person can do. All of this is to make sure that we are providing safe care and to not glorify the treatments that we provide. So they've determined that because the products we use are prescription only medications, it's quite unlawful to advertise the use of that. Before any treatments, we actually screen for body dysmorphic disorder, or also known as BDD, which is a mental health disorder involving a obsessive and persistent concern regarding to someone's perceived flaws in their appearance. So this can result into repeated cosmetic treatments with undesired outcomes because of how they see themselves in the mirror. This is to really make sure that the consumers that we see are both physically and mentally healthy. It's all in relation to our ethics. I think it's very important to be honest with our patients and to really be transparent and upfront about what we think is best for them. So here are some things you can ask your cosmetic nurse or doctor during your first consultation. What are their qualifications? When did they graduate? How long have they been doing cosmetic treatments for? What procedures they offer? What products they use? Are all very important to know. I think we don't ask that enough. There's nothing wrong with you asking what my qualifications are, what my experience is, if it helps you feel comfortable during the treatment. I think it's important to know what your cosmetic nurse can do or can't do. That comes in line with us working within our scope of practice and recognizing when treatments are too complicated, we need to refer you to someone else that is more specialized in that particular concern. Another important question to ask is what are the risks and side effects with the treatments that you're getting? So these are medical procedures that can have inherent risk and side effects, and it's very important to have a discussion because for you as a consumer, it's good to know the signs and symptoms of what to look out for and how, as your nurse, how can we manage that? How can we help you if those do occur? Another thing you can ask is what you can expect from these treatments. Is this going to give you your desired outcome? How many sessions do you need to get to your final goal? What can you do outside of the appointments to maintain your results? All of those things come in line with seeking out a practitioner that can answer all of those questions. Most of the time, you will need to come back, reassess, and see your practitioner more than once to get your desired outcome. Having a cosmetic nurse that is not going to over promise and under deliver is very, very important because these treatments are not cheap. So you want to make sure that whatever it is that you're spending on is giving you what you're expecting. The first thing you can expect during a consultation is having a discussion about your past and current medical health history. It's very important for us nurses to know what's happening in your physical health before we do any treatments. This will give us knowledge and information on any contraindications, any barriers to us doing the treatments that we are wanting to do that day. So some of the contraindications to take note of is if you're pregnant or you're breastfeeding, if you have any allergies to anything, if you're taking any medications, any vitamins, any surgeries recently, it's very, very important to let your practitioner know. The next thing we'll have a chat about is your motivations for treatment. Are there any special occasions coming up, special events like a wedding? Are you going overseas? This is so that we can plan out your treatments. Usually we wouldn't treat a client if they're planning to leave for overseas just because because if anything does happen during that time, we won't be able to support you and it's hard for us to intervene. The next thing that you might talk about during your consultation are your main goals and your main concerns for treatment. I find a lot of clients coming in concerned about looking tired or looking sad, looking saggy, and based on that, we talk about what their priority is so we can come up with a treatment plan together addressing their main priority area. So this leads to having a bespoke treatment plan. Everyone has their own motivation, their own concerns, their own goals and budget. And as a cosmetic nurse, I want to individualize my treatments because everyone is very different and it's all very individualistic, and I think it's important to really have that discussion on what is important for you and how I, as your cosmetic nurse, can provide you with that. So let's say you've had all of that discussion, you're happy to go with the treatment plan today. The next couple of steps are just all the process that we need to do, like calling the doctor for the prescription, taking before and after photos to keep in your clinical file so we can have a reference when you come back. After that, usually I talk about the aftercare, things you should do, things you shouldn't do for the next couple of days, and I generally book them in for a 2-week review. So I expect to have an assessment 2 weeks after our treatment to see how you're responding to the treatment that we did and to assess any need for touch-up or what is the next step from here. Keeping that communication line open between the patient and the nurse is quite important. This again comes back to finding a nurse or a doctor that you feel comfortable with so you can reach out, ask questions and seek support wherever you may need. So those are just some things to consider and questions to ask before you go ahead with your cosmetic treatment. So it's very important that you find a nurse you feel comfortable with and that they're able to ask any of your questions, because at the end of the day, we are here to provide you with holistic care, and just know that it's okay to back out and say no if you're feeling uncomfortable at the consultation as well. Thank you guys for watching, and I'll see you in my next video.